Welcome, future physicians. Today, we are diving deep into the cardiac cycle, the foundation of cardiovascular physiology, maybe one of the most important concepts that you need to understand. And it's a crucial concept for your USMLE exam and success and progress. Ever wondered what connects atrial fibrillation, heart failure, and murmurs? You got it right. It's the cardiac cycle. We will break the cardiac cycle, I'll break it down using our framework that I usually go back to of what, why, how, when, and where. By the way, this is in general a very good framework to understand any concept, any subject, any topic. You answer these questions about any of these, and you will get at least a good foundation and basic knowledge about that topic or concept. So I usually go back to using it time and time again, because I think it's more than adequate to explain the different aspects of about any topic. Okay, so let's grab our stethoscopes and get started. So hello, everyone. I'm Dr. Sara Ahmed. I have introduced myself multiple times in my previous videos, and I'm doing these videos to help USMLE Step 3, in particular, students and candidates to succeed. And the way I believe science in general and medicine in particular should be handled is by understanding the basics. And if you understand a concept, you are better equipped to deal with it, no matter how they came at you in the exam. It doesn't matter. They came from which direction. But since you understand the concept and you know the basics, you will handle it well. And to understand the basic of anything, start by collecting information as if you are a novice. You know nothing about it. Just you are brand new to that subject and you are collecting the basic information. Okay? And as you go and as you advance and progress in your medical career and studies, you will build more and more information. And of course, medicine is a very dynamic field. Things change, things progress, and new things come up all the time. So the basics, which are the physiology, the anatomy, the biochemistry of things, will not change much, but how to handle this situation, how to treat it will change all the time. So get a good grasp of the knowledge about the basics, and you will be in good shape no matter what they throw at you. So today's topic is about the cardiac cycle. The reason we are going to talk about the cardiac cycle because the cardiac cycle is a fundamental concept to understand a lot of cardiovascular physiology and pathology. A lot of cardiovascular diseases like heart failure, valvular heart disease, arrhythmias, all these, by the way, are linked to understanding the cardiac cycle. And yes, I will talk about this again, but the cardiac cycle basically is the heartbeat, what constitutes the heartbeat. Each heartbeat is one cardiac cycle. And this cycle has two components, an electrical component and a mechanical component. And when we say mechanical, usually mechanics deals with things like pressure, flow, temperature, opening and closing of valves and things. So that's what basically happens in the heart for it to perform its job, which is receiving blood and pushing it out, receiving it and pushing it out. That's basically, in the basic form, what the heart does again and again. That's why it's called cycle. So this is today's topic, okay? And it's whether you are preparing for a USMLE exam or just looking to solidify your knowledge or medical knowledge, you need to know and grasp the cardiac cycle, all the aspects of it. It's essential. You can't understand heart failure without knowing the cardiac cycle. You can't understand the effects and the impact of atrial fibrillation, which is a very common condition, without knowing the cardiac cycle. So really, it's essential. Let's break it down. And this is just an introductory video, by the way. I will not go into details of the different terms and the different definitions. I will just introduce what a cardiac cycle is. And I'm planning to do another video to follow this one to try to define some very important terms linked to this concept, medical terms. Okay? So we'll follow our framework of what, why, how, when, and where. And let's start with the what. Define it, the definition. Before we define the cardiac cycle, let's define the term cycle. What do we mean by cycle in biology or in science in general? Okay? The term cycle refers to a recurring series of events or processes that usually return to the starting point. Okay? We have so many cycles in life. We have so many cycles in biology, in chemistry, in physics, cycles. It starts somewhere, goes through a predefined and known, well-known processes, and it goes back to where it started. That's why it's called a cycle. Okay? It's a recurring event or a series of events. Okay? The length of this or the duration of this cycle differs depending on what cycle are we talking about. Is it the water cycle? Is it the life cycle or life cycle of the butterfly? Are we talking about another cycle of motorcycle? All these are things that happen or take place in a form of, in a cyclical manner, basically. So this is the definition of a cycle, and the cardiac cycle fulfills this definition. Why? Because it's a series of events and processes that takes place in exactly the same way over and over again. Okay? And it's the sequence of events that occurs during one complete heartbeat. One heartbeat is one cycle. It encompasses the mechanical and electrical activities of the heart, including the contraction and relaxation phases. In simple terms, it's how our heart pumps blood throughout the body and receives it back. That's a simple term of that actually defines this cycle. When we say pump, relax to receive. Pump meaning the cardiac muscle, the heart muscle contracts. This is a contraction phase. It contracts to push blood out. But to receive it back, it has to relax. Okay? And the contraction and the relaxation, it's a matter of pressure changes. And we know fluids move from high pressure to low pressure areas. Okay? High pressure to low pressure. Okay, this is the what. It's a cycle of events, steps, processes that happen during one heartbeat. And it involves or includes or encompasses contraction or pumping of blood out of the heart and relaxation to receive it back from the rest of the body. So why is it important? Now we come to the why question. Understanding the cardiac cycle is vital because it lays the groundwork for recognizing various cardiovascular conditions. For instance, in congestive heart failure, the heart's ability to pump effectively is compromised, leading to a cascade of symptoms. And we will talk about that in a separate video or videos. This is a big topic. Similarly, arrhythmias like atrial fibrillation disrupts the normal rhythm of the cardiac cycle. It's not that organized. Now it's chaotic. It's all over the place, which can have serious implications for the patient's health. So it's important because we will understand these pathological processes or the pathological processes behind these diseases, and we can deal with them better. So how does it work? The cardiac cycle consists of two main phases, but within each phase you have a lot of events that happen. Systole and diastole. During systole, the heart muscle contracts, pumping blood out of the chamber. This phase can be further divided into atrial systole and ventricular systole. We know that the heart consists of 4 chambers. 2 of them occupy the top part of the heart. We call them atria. We have a right atrium and a left atrium. The bottom part consists of 2 ventricles, right ventricle and left ventricle. The right atrium receives blood from the body, the whole body. Okay, it's deoxygenated blood. It's full of waste that we need to get rid of. Okay, it comes back to the heart. So the atrium receives blood from the rest of the body or the whole body, and it has to relax during diastole to receive that blood and contract during atrial systole to empty the blood towards the right ventricle, which is the main pump. The ventricle is the main pump of the right side. This right ventricle pumps this blood, which needs to be oxygenated or reoxygenated because it's low in oxygen and high in carbon dioxide. It pumps it into pulmonary circulation. Okay, and this process of receiving in the atrium, emptying from the atrium to the ventricle, and then emptying from the ventricle into the pulmonary artery is guarded by valves. Atrioventricular valve, we call it the tricuspid valve. Okay, and ventricular pulmonary valve, we call it the pulmonary valve or the pulmonic valve. Valves, the valve job, like any other valve anywhere else, is to regulate the movement of fluid or liquid or the blood. Okay? It has to close and open at specific times so that blood can, this process can be harmonized and synchronized. Okay? Okay, so this is the right side. Then the blood from the pulmonary circulation, after it's cleaned and reoxygenated, it comes back, cleaned of carbon dioxide, of course. It comes back to the left atrium. So usually the atrium is the reception part. It receives blood. And during its diastole, when it's relaxed, it receives the blood from the pulmonary circulation. And during its systole, when it contracts, it pushes the blood down into the left ventricle, which is the main, more powerful pump of the heart, the left ventricle. The left ventricle pushes the heart into the blood into the aorta, which is the biggest artery in our body, through the aortic valve. So the left atrium to left ventricle, mitral valve. It opens, allows blood to move. Then a series of events happen with changing pressures, closing the valve, and then ventricular systole pushes blood into the aorta through the aortic valve. All these events I mentioned happen during one heartbeat. Okay? But remember, diastole indicates relaxation and reception of blood, and systole indicates contraction and pushing of blood from wherever area we are talking about. Generally, the atria are weaker, and even when they contract, it's at the end of the blood passing towards the ventricle. It's not a very powerful process, but it's necessary to completely empty the atrium. Okay? Okay. So this is one cardiac cycle. That's how it, and that's the meaning of systole and diastole. So the two main parts of the cycle or the cardiac cycle are systole and diastole. Okay. When does the cardiac cycle occur? That's a tricky question, actually. The cardiac cycle occurs continuously throughout our lives, throughout the day, throughout the night, throughout the lives. It's the indicator that the heart is working. Okay? The heart is beating. If it stopped, we are dead or we will die. Okay? Each cycle lasts about 0.8 seconds. And how did we come up with this time? We came up with this time because we think this is at rest. This is at rest, where our heart beats about between 70 to 75 beats per minute. Okay, which is the resting normal heart rate in a healthy person. Some people have a very or slower heart rate. They can beat their heartbeat at 60, for example, at rest, and they're totally fine. And this happens frequently with athletes. Athletes have a more efficient heart. It has a stronger beat, it pushes blood more and more efficient. So it doesn't have to compensate by beating more. Some have a resting heart rate that's more than 90 or so, which is kind of fast. But with the calculation of a resting heartbeat of between 70 to 75, we'll find out the cardiac cycle takes about 0.8 seconds to be completed. Okay? All these events of systole and diastole within all the chambers of the heart happen within that less than a second. Okay? And they start again. They start again. The duration, as you can imagine, of each cycle varies with the heart rate. If it's fast, then we have lesser time to complete that cycle. If it's slower or the heart rate is slow, then we have longer time to complete the cycle. Okay? Okay. We know situations, of course, the heart rate gets faster with exertion, activity. It gets faster with stress, and so on. It's very important to recognize these things and to know the impact of having longer duration or shorter duration to complete the heart cycle. It has some therapeutic implications later that can become clearer when you are dealing with people with heart failure or atrial fibrillation or other conditions. Okay. Now, when we come to answering the question, where does it occur? It happens within the heart, of course, specifically in the four chambers. Each chamber goes through its own mini cycle. Yeah, because as we said, it's two phases, two big phases, systole, diastole. So they go through this systole and diastole each time the heart cycle starts or the cardiac cycle starts. And so each one has their own mini cycle to complete their function, because each of these four chambers has a function. Okay? So each of these chambers plays a unique role in the cycle, ensuring that oxygen-rich blood is delivered to the body, while deoxygenated blood is sent to the lungs for reoxygenation. Remember that this is what the heart should do. That's the function of the heart. Okay. In summary, the cardiac cycle is a complex yet beautifully orchestrated process that's fundamental to our understanding of cardiovascular health. By mastering this concept, you will be better equipped to tackle clinical scenarios related to heart disease. If you found this video helpful, please like, subscribe, and share it with your fellow medical students. I think it's very important for everybody to know these basic things about different concepts. And let's continue to build a strong foundation in medicine together. I would like to continue this series, but your interaction with it will encourage me to continue. Thank you for watching, and I will see you in the next video, where I will continue to talk about the cardiac cycle, by the way. I need to go a little bit more deeper than what I did in this video. And by introducing more details and explaining some important terms and their clinical implications, that's a promise. So see you there.